Randy Shep spends most of his time in a laboratory at Fort Detrick. The Maryland base is home to USAMRIID, the U.S. Army's Infectious Disease Research Center. But when Ebola struck West Africa, Shep packed up his gear and headed for Liberia.
Suddenly, I was making decisions that affected a person's life. It was quite sobering, kept me up at night.
Shep was helping set up labs to test patients for Ebola. He says it was nerve-wracking.
If I tested somebody and got a false positive, I was taking a potentially negative individual and sending them into an Ebola ward where they could get infected.
A false negative would not be much better.
I was possibly sending someone that had Ebola into the community where they could transmit that virus to others.
He says the diagnostic tests used for Ebola are excellent, returning very few false positives or false negatives. But they require high-tech equipment, a well-equipped lab, and trained technicians. In remote rural areas far from a hospital, health workers may have none of these. That calls for an accurate test that is also simple and portable. One like the test Shep had been working on.
It was one of those things that was developed years ago to have on hand, but we never thought we'd use it. And we kind of pulled it out of mothballs to begin the test, and it's a nice test.
So instead of having to carry big, heavy, and complicated equipment out to a remote village someplace, you can just take these little plates, and all it will take is one little line to tell if the patient is infected or not.
Put a few drops of blood on one end. For this demonstration, Shep uses a test solution, not blood. In just 15 minutes,
if you have Ebola there, it gives you a line. If there's no Ebola there, there's no line.
It's fast and simple, but it comes with a cost.
For that convenience and quick 15-minute assay, you trade off sensitivity.
That means the test can miss some patients who have Ebola. A negative result needs follow-up to be sure. Several groups are testing these kinds of diagnostics in real-world conditions, which can be very different from performance in a lab. Optimistically, a new test may be ready in a few months. But experts say it's too soon to know if any of them work well enough in the field, or if the high-tech test is still the only way to go. Steve Baragona, VOA News, Fort Detrick, Maryland.